If you think about our own lives, just anybody's life, you're in contact with many different parts of the system, aren't you? You need to sort out your primary care, your general practice, you need to sort out your housing and accommodation, you need to work through what your employment arrangements are, or if you're not working, you need to sort out your benefits, you might be arranging care for your children. All of those different organisations that impact and are involved in your life and in your well-being. So when someone's suffering from or having a period of distress, or has a mental health issue, or someone who's got a learning disability who finds interacting with all those different organisations difficult, then coordinating those and getting those agencies to work together is a way that we can help that individual move forward with their lives.
I'm educated, I have a BA Honours degree, I have a postgraduate diploma. I have a profession that I have worked for many years in when I'm well, and I'm well respected within my own professional circles. I have a daughter, so I'm a mother. I have parents, I have sisters, I have a family. One of the first things that happens when I walk onto an acute ward because I've become unwell and I'm not able to care for myself, the first thing that happens is all of that recedes. None of that matters. All of that goes. And I become a number. I become a collection of symptoms. People start talking about how I am presenting. I think, oh, what, am I doing a musical? Song and dance? I'm not presenting anything. I'm not feeling very well. Can somebody help me? None of that has anything to do with anything the staff has done. That's just the process of walking in through the door. I feel dehumanised. I was assigned a support worker from the community mental health team who introduced me to a group called RAP. RAP stands for Wellness Recovery Action Plan, and the whole point of RAP is that it empowers the service user to take greater responsibility and greater participation in their own care. I had become very, very ill at the beginning of the summer for very many reasons, and what I became aware of was the medication that I was on was not managing my symptoms. And my support team from the community mental health team had sort of said, you know, maybe you ought to see your GP, talk it over with her. They had warned me, and it was the case, that the medication had quite an adverse impact on me while it was settling into my system, and that's really where my crisis plan kicked in. My support worker came out to see me, and in collaboration with the crisis team, they phoned my care coordinator, got a copy of my crisis plan that I'd written in association with RAP, and everything just worked like clockwork. My daughter was taken care of. She went to a friend's house my friend had previously agreed she would look after my daughter and keep her at school until her father could come and get her. My wishes about how I should be cared for were all taken into account because they were there in black and white, that I had written down at a time when I was really well, and co-signed by, you know, my GP to say yes, you know, this is acceptable. And I think the most important thing about that was, in accordance with my wishes, I didn't need to go into hospital to be started on this new medication, which, you know, maybe 5 years ago, maybe 6 or 7 years ago, that may have been, you know, one of the options that was put on the table, but that wasn't necessary. My life has changed so much through the involvement of RAP and being able to take greater responsibility for my own health, which sometimes just means knowing when to seek the interventions and which interventions are appropriate.